Hey everyone, Dr. Tam here, your wellness and pain specialist here in Vacaville, California, where every single day I try to bring some tips of health, function, and longevity. So today I want to talk to all of our diabetic patients out there and patients who have family members and people that you know who have potentially diabetes or who are also pre-diabetic. What sparked this thought and conversation is yesterday we had a patient who's been a diabetic patient for the last 20 years, except recently she started noticing that she could not feel her feet. Liquid was going down. She dropped a cup of liquid on her leg and could not feel the liquid going down her leg. A lot of you might think, well, mine is not that bad. Well, don't wait until it gets that bad. And here's what you have to do. Whether you're a diabetic or even a pre-diabetic, you cannot undermine the seriousness of your problem. Because even when you're a diabetic or a pre-diabetic, that means an organ, most likely the pancreas, the insulin, something is failing in your body to perform. It's not performing at normal. By the time you are able to test your sugar levels, that it's not normal, that means your system has been compromised for a long time to the point now where it's actually showing up in your bloodstream, okay? That means your body can no longer handle it. Think of garbage on the street. If waste management is cleaning up garbage on the streets and garbage is starting to pile up on your streets, that means they have been working tirelessly to try to get rid of garbage on the streets for a long time, but it has now exceeded the demand for the garbage on the streets. That's the same thing for your body. If you are testing higher than normal resting sugar blood levels or higher than a 5.7 A1C, that means your body is failing. It's time to really wake up and start getting checked, okay? The biggest thing in diabetes is people not knowing exactly how to manage it correctly. A lot of you are getting false information, maybe not the completely false, but not the best information on how to take care of your bodies or what to eat. Most diabetics I talk to, they are still confused about what they should be eating, what they shouldn't be eating. A lot of you think that eating wheat bread is a lot better than white bread, or the fact that you're eating whole grain, it becomes a lot better. And I gotta tell you, it's not true, okay? It's not 100% true. So, but it comes down to, can you feel your feet? My goal as a doctor is I do not want it to get this bad for the patient that we saw yesterday, because this was another patient that we had to turn away because I could not help this patient. See, when we test neuropathy and test sensation in your feet, that number is very significant. It's 85, which means that if you have more than 85% of your nerve sensation is lost, the chance of it getting it back, studies show, is slim to almost none. What does that mean? That means once the sensation is gone past 85%, we can't get it back, no matter what you do, okay? And this patient, she was way past 85%. She was in the 90 percentile, and there was nothing we can do. But here's some things that you have to know. You don't have to wait to get this bad before you get tested. Go to a specialist near you and really get your neuropathy sensation tested. A qualified specialist will be able to test different things. What I mean though is not go to just any regular clinic and where they put the pins and needles and give you shockwave or shocking sensation. You don't need to be electrically shocked. I want you to understand, when you are electrically shocked, what happens is the nerve running down from your feet all the way up to your leg is being tested. But in neuropathy, that's not the nerve. It's not that big nerve. It's your peripheral nerves that need to be tested. How the peripheral nerves are tested, number one, you have to test sensation. You have to test balance. You have to test strength, okay? The first sensation that needs to be tested usually is going to be cold sensation. Can you feel vibration sensation? Can you feel heat sensation? Can you feel pinprick, pressure points, okay? How is your balance? All right, so these are all the things that needs to be tested. There is no one size fits all type of test or one test where they can run or the doctors can run where it's the shock sensation test. Someone has to do that test individually. Right now, we are starting a home packet. What we are putting together is a home packet, home program where people with diabetes, maybe during this time is not able to leave their home, is able to purchase a packet. We will have videos for you to show how you can now test yourself at home very thoroughly too. Not just, it's not a flimsy test. This is a very thorough test. From that test, we will have results, okay? And from there, you're able to see the severity of the neuropathy and how much you're actually able to feel. Those of you who are interested in that test, leave a comment below or call our office, and that way you will be on the waiting list once we have completed the test. Now, the key is get tested. Do not wait, because this patient in the last 2 months that we tested yesterday ended up in a walker in the last 2 months. And she's had diabetes for over 20 years, but no one took care of her or told her exactly what to do, okay? You need to really take control of your diabetes, because diabetes can end up causing diseases like peripheral neuropathy, autonomic neuropathy. Okay, what is peripheral neuropathy? Peripheral neuropathy is where you could start feeling tingling, numbness, burning, cramps, sensations. Maybe it's pins and needles, okay, in your feet or ankle or your calves. It can also work at the fingertips, the hands, going up the forearm, okay? The other thing it can cause that no one really talks about is autonomic neuropathy. What is autonomic neuropathy? Autonomic neuropathy is when neuropathy, which is caused by diabetes, cancer, alcoholism, multiple different things. Autonomic neuropathy is where your autonomic nervous system starts to shut down, and it will cause heart problems, breathing problems, lung problems, liver problems, okay? It will cause digestive problems. Did I mention bladder? Bladder and bowel problems, sexual dysfunction, all right? That's autonomic neuropathy. So you have to get and manage the diabetes correctly, figure out what you need to do, figure out how bad the neuropathy is. If you are within a 3-mile radius of Vacaville, California, we are zip code 95687. Just Google it on your phone. When you press the directions, if you're within 3 hours, all right, give us a call, okay? Because within that time frame, we're one of the closest offices to you who specializes in doing neuropathy pain testing, all right? If you are in other areas, comment below, because we will do our best to find someone near you. But you have to get tested so that you don't end up like our patient yesterday, with her being in a walker the last 2 months, having intense swelling in her feet, not being able to walk anymore correctly without losing her balance, and where there's nothing that we can do. She waited too long. We get patients at least, I would say, once every month, once every 2 months that come in who has waited too long. And I really hope that she didn't wait that long, but I hope that if you know someone who has diabetes or who has neuropathy, who has that tingling pain, numbness sensation, let them know the seriousness of it. Let them know, share this video with them and get them tested. Okay? I know that if that was my mom or someone in my family, I'll let them know right away, because most people don't realize the danger of neuropathy and the problems that can cause in the long run, not just for the patient, but for their family members as well. All right? Until next time, that's my tip of the day. I know it's a long tip, but I wanted to give you guys something that was more in detail. Have a great day.